Despite what you may have heard about hospitals being overwhelmed, the new federal database shows there are beds to spare at the Portland area's biggest medical centers. COVID is no question a huge problem in some parts of America, but the current numbers show there is capacity here.
When I looked through the data for not just Emanuel, but for the other ones, it's in the ballpark.
That's Dr. Melinda Muller, the interim chief medical officer for Legacy Health. She reviewed the new database before our interview. It shows, using a 7-day average, that Oregon Health Sciences University, OHSU, has 37 beds available, that Providence St. Vincent has 64 beds available, that Providence Portland has 62 beds open, and that Legacy Emanuel has 63 beds available. Dr. Muller said Legacy is about as full now as it normally is in December.
Our hospitals are fairly full. I mean, we're busy all the time, so I think it's probably somewhat comparable because I remember flu season. This is flu season last year, and we haven't seen hardly any flu. So I think it's close. Are we busier now than then? I don't know the exact numbers, but we're probably similar.
It is an unexpected silver lining. All those steps we take to keep from getting COVID are probably helping us keep from getting the flu as well. Still, the influx of all those COVID patients, 380 from late October to late November, does have a lot of people nervous. Becky Hultberg is the CEO of the Oregon Association of Hospitals and Health Systems.
We have seen a dramatic increase in COVID hospitalizations over the last month. If you project that forward, our beds are going to be filled. And so what we really need is for people to understand that the actions they take today can reduce hospitalizations in the future and thus preserve our hospital capacity.
So yes, there is worry the hospitals will be swamped, but the database shows they are not swamped yet.
We definitely have our surge plans in place. It's a little bit better right now. We're obviously watching in the next week or two for the post-Thanksgiving potential surge, but we're doing fine right now.
Some of the surge plans include canceling more elective surgeries or moving patients to hospitals with more open beds. Finally, like the good doctor that she is, Dr. Muller said we need to keep wearing our mask, wash our hands, stay away from people, and stay home when we're sick. In Northeast Portland, Pat Dooris, KGW News.